Welcome to this monthly webinar of IMA AMS TNSB. So greetings from AMS. This is our monthly regular webinar program every first Thursday. So I thank all our IMA leaders, state and national leaders for this wonderful opportunity to spread the knowledge across India. So this is a panel level meeting from IMA TNSB. We are conducting this program. So every month we have a wonderful theme. So this month we have a World Organ Donation Day. Under this theme, we have a very important 4 topics and 4 stalwart faculties in this today's webinar. We'll be discussing a lot of things. I thank all our IMA leaders from the national and the state leaders. So thank you for this wonderful thing. We'll start the program with a prayer. May I request Dr. Adar Sandil Kumar for the physician prayer and IMA prayer. Over to Sandil, sir.
Yes, sir. Thank you, sir. Physician's prayer. Dear Lord, thou great physician, I kneel before thee. Since every good and perfect gift must come from thee, I pray, give skill to my hands, clear vision to my mind, kindness and sympathy to my heart. Give me the singleness of purpose, strength to lift at least a part of the burden of my suffering fellow men, and a true realization of the rare privilege that is mine. Take from my heart all the gold and worldliness, that with the simple faith of a child I rely on thee. I am a prayer. May everybody be happy. May everybody be healthy. May everybody be free from pain. May everybody be free from sorrow. May we be the healing cure beyond every greed and lure. Thank you, sir.
Thank you, Sandil, sir. May I welcome our chairman of IMA AMS TNSB, Dr. V. Rajesh Babu, sir, for the welcome address. Dr. V. Rajesh Babu, sir, is a senior consultant neurosurgeon and head of the department in Ganga Hospital, Coimbatore. Dr. Rajesh Babu, sir, is a former president of IMA Coimbatore and currently is a chairman of Organ Donation Committee, IMA TNSB, along with the IMA AMS chapter chairman. Over to Rajesh Babu, sir, for the welcome address.
Good afternoon, everybody. First of all, I welcome our president, Dr. P. Senguttuvan, sir, for joining this program in spite of his busy schedule. And I also welcome the State Secretary, Dr. Karthik Prabhu, sir, for this program. And I also welcome Dr. V. Amudan, sir, the Vice Chairman of IMA AMS National Headquarters. And I welcome Dr. B. Sridhar, sir, the State President-elect 2025. And Dr. K. M. Abul Hasan, sir, immediate past State President. And I welcome Dr. S. Gauri Shankar, sir, the Honorary State Finance Secretary. And I like to welcome today's speakers. One of the speakers is myself, and another speakers, Dr. Pradeep Kumar, Dr. Maria Antonio Bruno, and Dr. Raghavendran, sir. See, actually, every month we are having the programs, and this month is an organ donation day is coming on 13th of August. And because of that only, I have planned to have the program today, this month. And what I thought was some of the important things which we should know day to day. One thing about the NMC new guidelines have been formed. Our Dr. Pradeep Kumar is well versed in the NMC, so I asked him to give a talk. And Dr. Maria Antonio Bruno also is going to give a talk. It's a very interesting talk. First notice for alleging negligence, how to deal. It's a very interesting topic. This actually, each and every one of our IMA members should hear that, because it is a very, very informative lecture. And also regarding the brain death certification, we are having this Dr. Raghavendran, because he is one of the members of the advisory committee in the Transton. And the latest guidelines, we followed, are well known to him. That's why we have included him, and he will be joining at last. Actually, he has gone for his secretariat meeting. He may be joining at any time. So that is today's program. And I welcome you all for this program. And I wanted to inform one of the important things about the IMA AMS. I request all of you, the specialist people, to become the members of the IMA AMS. And every year we are having annual conference during November, and this year we are having the conference in November at Chandigarh. And during the conference, the fellowship of the IMA AMS will be given. FIAMS it is called. For that, the applications have already been called for, and last date for application is on October 31st. I invite all of you to please enroll yourself and get, because the registration fee is hardly 8,900 rupees only. And I request all of you, those who are interested to have this FIAMS degree, please apply and get your degree certificates. So I welcome you all for this CME. Thank you.
Thank you, Rajesh Babu sir, for your welcome address to invite all of you for our National AMS Conference to Chandigarh. Thank you very much. So may I invite our State President, Dr. Senguttuvan sir, for the presidential address and inauguration of this CME program. Over to our President, Senguttuvan sir.
Thank you, Dr. Jayaraman. Respected President-elect, Dr. Sridhar. Respected immediate past President, Dr. Abul Hassan. IMS Chairman, Dr. V. Rajesh Babu. Dr. Amudan, Headquarters Vice Chairman. Secretary, Dr. Karthik Prabhu. Finance Secretary, Dr. Gauri Shankar. AMS Secretary, Dr. Jayaraman. Dr. Sendil Kumar, Joint Secretary. And today's speakers, Dr. Pradeep Kumar, Dr. Rajesh Babu, Dr. Maria Antono, and Raghavendran. I think every time Dr. IMS specialty is doing a wonderful job and giving different topics different from the expert speakers. So it will be useful to all the participants who are participating in today's webinar. So it will be useful for them, and I request all the participants to take the points of the speakers so that it will be useful for your practice. As said by Rajesh Babu, please enroll yourself as a member of the Academy of Medical Specialties and being AMS, and also get the fellowship degree of FIAMS. With these few words, thanks for the opportunity. I inaugurate this webinar and best wishes to all. Thank you. Over to Dr. Jayaraman.
Thank you, President sir, for your welcoming and presidential address and for the inauguration of the CME. Thank you, President sir. So now I'll give my secretary's report. This is our team, Chairman Rajesh Babu sir, and myself, Secretary Dr. S. Jayaraman, and we have Joint Secretary Dr. Adar Sendil Kumar sir. And this is the brief activities of July month. So July 1st, National Doctors Day. So we circulated all the greetings to all the members of our IMA and the doctors for the commemoration of birth and death anniversary of birthday of our Dr. B.C. Roy, Bidhan Chandra Roy, one of our modern medicine doctor, our mentor. So this is the program in Chennai, Rotary Club of Chennai Medical Fraternity. First time in the Rotary International, we have started a unique club, only doctors club in the Rotary, only medical fraternity. So from the Rotary, we organized the Doctors Day Award ceremony in our club. I am the president of the Rotary Club of Chennai Medical Fraternity, and our IMA AMS chairman for the contribution in pulmonology and sleep medicine. Gayatri Devi ma'am is chairman of IMA AMS Villivakam Ainavaram branch, got the Doctors Day Award from our chief guest, SRM group of chairman, Dr. Ravi Pachamuthu, along with the other district Rotary leaders. So this is the important Doctors Day program from our branch, got the Best Doctor Award from the Rotary. And we had our scientific meeting of our IMA, Chennai Villapayanappuram branch AMS wing, conducted the program on 20th of July. And again, 24th July, we conducted the special inauguration webinar of critical care medicine and Cosmedima and the hospital marketing mastery course. So almost critical care medicine will be starting from next month, and the hospital marketing course already. So we'll be starting from our esteemed today's speaker, Dr. Pradeep Kumar. So we have a lot of courses. These are all the fellowship course under the IMA AMS banner. More than 45 courses, including the Critica and other courses. So all the courses are available. I request all the specialist doctors practicing in the multi and super specialty hospitals in various towns and cities. You can choose the courses according to your branch and start your fellowship program, 4 months, 6 months, 1 year program. This is for our own IMA members. So fine-tuning their knowledge. I request everyone kindly take into considerations and form the course module and send to our chairman Rajesh Professor or myself. So we'll forward it to our head office, Tamilnadu State Office, under the secretaryship of Dr. Karthik Professor and Sengadun sir. So we'll form the guidance after the discussion in the academic council. So we'll start the courses of 4 months, 6 months. So I'll be happy to any queries, please feel free to ask us or ask our chairman Rajesh Professor. These are the courses already started in Coimbatore and Chennai. Laparoscopy IMA course, 6 months course, and diabetic retinopathy course in Coimbatore is also this is a 4 months course. And infertility course in Coimbatore, the 6 months short-term fellowship course in specialty. This is arthroplasty course in Coimbatore. Regima 2024 already started. This again second batch is going to start now. Regima 2025. Regenerative medicine is 6 months and 1 year fellowship course available in Trichy under the directorship of Dr. Ravi. He is orthopedic surgeon in Maruti Hospital, Trichy. And we have a sleep med IMA 2024 first batch over, second batch already started. For the past 1 month, we are doing this 6 months fellowship course in sleep medicine under the directorship of Dr. Shivani Swami, the National Authority in Sleep Medicine. I am the course coordinator in MGM Healthcare. We have started this course, 6 months course. Currently, we have 13 candidates joined in our second batch. First batch already 11 students, 11 candidates joined and successfully completed all the exam attendance, everything. So course completion certificate as given. This sleep edema second month will be starting this Sunday. We have an online class through Zoom portal, 10 a.m. to 1 p.m. all for our IMA AMS members. And this is the course fee, including GST, 35,400 for 6 months. This course only on Sunday in MGM Healthcare, online. First Sunday online, second Sunday offline, and third Sunday online. Specifically, we design the courses morning 10 to 1. We learn all about the sleep disorders. I am the course coordinator. Welcome to join all the courses. The TMA newsletter also, we have given all the details. So, and we had a wonderful program, 24/7. That is course inauguration done with our stalwarts. This is another kind of a specialty program that is international conference on sleep disorders, along with the Oscillation Sleep Association. IMA AMS of our Tamilnadu chapter also taking part as academic partner in this program at Chennai, Hotel Green Park. This will be 3 days international conferences, 1 day pre-conference workshop at Apollo Simulation Center, and 2 days there is a specialty sleep conference all about sleep disorders. I welcome everyone to join Chennai. This is the first time in India we'll be conducting along with the Oscillation Sleep Association, 3 days conference. I welcome to join. Sleep is a very common subject matter. You all know very well. Sleep is a vital thing. So welcome to join this thing. May I request our national and state leaders for the felicitations. May I request our chairman of IMA AMS, Dr. Ramnik Singh Bedi, sir. If sir is there, you can unmute, you can give the presentation, sir. May I request our vice chairman of our IMA AMS headquarters, Dr. V. Amudan sir, for the felicitation. Over to Amudan sir.
Thank you. First of all, my regards to President Dr. Sengadun sir and State Branch Secretary Dr. Karthik Prabhu for their wonderful work. And I appreciate the dedicated work of the IMA AMS Chairman Tamilnadu State Branch, Dr. Rajesh Babu, and Secretary. And I all welcome you to the IMA AMS National Conference at Chandigarh. So I request all of you to register for this. Some one or two issues were pointed out by some of the members from South. Whether the CME credit is being given to all IMA AMS members only or IMA members. I want a clarification on this. Second point is that they want to become member of this IMA AMS WhatsApp group also. So for this, I request a clarification from the secretary. Finally, I thank Rajesh Babu for his dedicated work on organ transplant. Even before 3 years, he was conducting a detailed symposium on organ transplant, for which he got award from the national headquarters at that time. Thank you and congratulations. And over to Secretary for the clarification on the 2 points. 2 points. One is CME credit is given to all IMA AMS members only or all IMA members. Second point is for becoming member of this WhatsApp group, you have to be member of IMA AMS or not.
Yes, sir. So we insisted. Rajesh, sir, shall I continue or you want to give the
You
answers?
can tell, sir. You can tell.
Yeah. See, this is a conference mainly for the IMA AMS conferences. Already we have started the WhatsApp group. So I request every members, those who are IMA AMS or those who want to become the IMA AMS member, so you can eligible to take part. So this is what we had a discussion, sir. So any clarification, chairman point of view, chairman perspective, you can tell about, sir. Chairman, sir. Chairman, sir.
Sir, actually for the IMA AMS CME meetings, we are giving credit hours for all the people who are applying here. That's what we are doing it, sir. Because the number of people attending are usually less. At least today we are having a good strength of 136 people. Last month and all we had only 100 people only. See what, only because people who are joining here, we wanted to give the credit hours. That is the thing. So we are giving credit hours for all the people who are joining. And we are actually planning to give a concession for the people who are IMA AMS members. That's what we are going to plan for it. That is a new plan. We are thinking about it. What is the advantage of having an IMA AMS member? That is the thing, sir.
Thank you for your clarification, Dr. Rajesh Babu. Thank you. Thank you very much.
Thank you, Amudan sir, for your wonderful felicitation. And the IMA AMS National Conference will be held at Chandigarh. We are welcoming from the AMS headquarters perspective. Thank you very much. May I request our IMA AMS National Headquarters Honorary Secretary, Dr. C. Sairam sir, for the felicitation. Okay. May I request our IMA AMS, our IMA State Branch, State Honorary Secretary, Dr. S. Karthik Prabhu sir, for the felicitation. Karthik Prabhu sir.
Yes, sir. Thank you. Good evening, President and all the leaders of IMA. IMA is doing a wonderful job, sir, and I'm also happy to see the presentation of Rajesh Babu, sir, regarding the anaphylaxis kit, for which I was also a bit instrumental on that as I was affected by that. So best wishes to the program, sir. Great going. Look forward to hear from you. Thank you, sir.
Thank you, Secretary Karthik Prabhu sir. May I request our State Finance Secretary, Dr. Gauri Singh sir, for the felicitation. May I request our immediate past President of IMA TNSB, Dr. K. Abul Hassan sir. Over to Abul Hassan sir. President-elect Dr. B. Sridhar sir. Okay. So with that, I conclude my secretaryship report. I thank you all the leaders for this wonderful opportunity. May I request our Joint Secretary, Dr. Adar Sendil Kumar, please take over and start the CME program. Over to Dr. Adar Sendil Kumar.
Yes, sir. Thank you very much, sir. Today we have 4 speakers and 4 topics. The first topic, the speaker from Dr. Pradeep Kumar, is going to talk about the NMC guidelines, do's and don'ts. Dr. Pradeep Kumar, are you ready?
Yes, I am ready.
Yes.
Good evening, everybody. So without much ado, we'll start with the presentation. தமிழ்லயே பேசுறது ஐ திங்க் எல்லாருமே தமிழ்நாட்டில் இருக்கிறவங்க தான் இருக்காங்கன்னு நினைக்கிறேன். ஸோ நம்ம தமிழ்லயே வந்து என்னோட டிஸ்கஷன் இருக்கும். ஸோ மெயினாக வந்து வாட் ஆர் த டூஸ் அண்ட் டோன்ட்ஸ் ரிகார்டிங் த NMC guidelines. That is what we'll be seeing today. So everybody knows a little bit about me. I have trained over 150 hospitals and doctors throughout Tamilnadu through IMA AMS chapter. We have been doing it in person from Coimbatore, Madurai, and even on Zoom. We have done so many training programs for hospitals and doctors. I'm also the convener of the wellness committee of IMA Tamilnadu, and I have my own hospital, that is an IVF hospital at Kanyakumari. ஸோ ஃபர்ஸ்ட் கொஸ்டின் எல்லார் மனசுலயும் இருக்கிறது, எதுக்காக வந்து நான் வந்து இந்த டீடைல்ஸ் தெரிஞ்சுக்கணும், வாட் ஹஸ் NMC டு டூ வித் மீ, எனக்கும் இந்த ப்ரொஃபஷனல் மிஸ்கண்டக்ட் ரூல்ஸ்க்கும் என்ன சம்பந்தம் அப்படிங்கறதான் எல்லாரோட மைண்ட்லயுமே இருக்கும். ஸோ ஃபர்ஸ்ட் நம்ம என்ன தெரிஞ்சுக்கணும்னா, இக்னரன்ஸ் ஆஃப் லா இஸ் நாட் அ வேலிட் டிஃபென்ஸ். நமக்கு ஒரு விஷயம் தெரியலன்னு சொல்லிட்டு நம்ம வந்து அது ஒரு டிஃபென்ஸா வந்து எங்கேயுமே யூஸ் பண்ண முடியாது. ஸோ வி ஹாவ் டு பி அவேர் ஆஃப் ஆல் தி கைட்லைன்ஸ். ஸோ நம்ம வந்து மெடிக்கல் கவுன்சிலில் ரெஜிஸ்டர் பண்ணும்போது இந்த மாதிரி நம்ம கிட்ட ஒரு சிக்னேச்சர் வாங்கியிருப்பாங்க. ஸோ என்னென்ன நம்ம வந்து வாட் ஆல் வி பிளட்ஜ் டு டூ, வாட் ஆல் வி ஆர் நாட் சப்போஸ் டு டூ அப்படின்னு. மெனி ஆஃப் அஸ் மே நாட் பி அவேர் ஆஃப் இட், பட் வி ஹவ் ஆல் சைன்ட் திஸ் டெல்லிங் தட் வி ஷல் அபைட் பை த கோட் ஆஃப் மெடிக்கல் கான்டக்ட். நமக்கு தெரிஞ்ச மிஸ்கான்டக்ட் எப்போ வருதுன்னா, கிராஸ் ரூல்ஸ் வி ஆல் நோ. நம்ம வந்து இப்போ ப்ரொஃபஷன்ல வந்து வி ஆர் இண்டல்ஜிங் இன் some sort of drug or alcohol, or there is some sort of sexual misbehavior or gross misconduct like telling the sex of the baby, and the doctor வந்து இந்த மாதிரி எல்லாம் சொல்றாங்கன்னா we all know that this comes under gross misconduct. பட் நமக்கு தெரியாத நிறைய விஷயங்கள் இருக்கு. ஸோ ஃபார் எக்ஸாம்பிள் வந்து சர்வீஸ்ல இருக்கவங்களுக்கு தெரியுமா, இது நம்ம வந்து இப்போ DME சைடு ஒரு மெடிக்கல் காலேஜ்ல இருக்கோம், நம்மளோட சுப்பீரியர் வந்து ரவுண்ட்ஸ் வரும்போது we are not found in duty, நம்ம அந்த டேபிள்ல இல்ல, நம்மளோட போஸ்ட்ல வந்து இல்ல அந்த டியூட்டி டைம்ஸ்ல அப்படின்னா 2 occasions மேல that will be deemed as a misconduct and you can be reported to the medical council. So இந்த மாதிரியான நிறைய தெரியாத ஃபேக்ட்ஸ் இருக்கு. So that is what I'll be highlighting today. இது சோஷியல் மீடியால வந்து we would have all seen, we know that ஒரு influencer, he is cutting the umbilical cord of his own baby in the theater. It is not a normal delivery, it is a cesarean delivery, and hospitalல வந்து அவனோட பேபியோட umbilical stump வந்து he cut. So this was reported to the medical council, and the medical council has taken action, suspending the hospital to provide any service for 10 days. And this is another news that people, doctors who are supposedly displaying their degrees, like நம்ம வந்து மெடிக்கல் கவுன்சில்ல ரெஜிஸ்டர் பண்ண டிகிரிஸ் மட்டும் தான் வந்து நம்மளால டிஸ்பிளே பண்ண முடியும். Other degrees when we are displaying, that is also not allowed as per medical council. So we may not be knowing about rules like this. So this is what I'll be highlighting. So I am talking about my own story. So I am having an IVF hospital, and I used to claim like we have guaranteed success rates. We have more than 500 pregnancies in 1 year. All this we were doing it online and also through print. So what happened was I did not know that this was not compatible with the NMC rules. So I have received a complaint from the medical council saying that what I have done is not ethical. So I had to visit the medical council and give an explanation. So there will be a committee of senior doctors and we have to submit our explanation. So what we think இது எனக்கு அப்ளை ஆகாது, நாம் பண்றது வந்து gross misconduct இல்ல அப்படின்னு we are thinking, but அப்படி கிடையாது. So we should all be aware of this and we should make sure that we follow these ethics diligently. So newspapers வந்து we see lot of hospitals advertising, but what exactly is allowed? We'll all be surprised to know that we can only advertise when we start practice, when we change the address, or we are not available. For example, ஒரு ட்ரிப் போறோம் நம்ம 15 days இல்ல, that can be announced in the newspaper. And when we resume the practice and நம்மளோட charges, நான் வந்து ஒரு பேஷண்ட்க்கு இவ்வளவு ஃபீஸ் கலெக்ட் பண்றேன், இந்த விஷயங்கள் மட்டும் தான் வந்து a doctor is supposed to advertise. And hospitals also, they are also supposed to advertise only the name of the institution, what patients they see, and what kind of doctors they are, and their fees. Anything apart from this is not allowed as per NMC norms. So we all should be familiar with the code of conduct, which was again modified in 2023. இதுல என்ன சொல்றாங்கன்னா, ஒரு டாக்டர் வந்து தன்னைத்தானே வந்து பெருமையா வந்து பேசக்கூடாது. அவரோட ஸ்கில்ஸ், அவரோட குவாலிஃபிகேஷன், நான் IMA வந்து இந்த போஸ்ட்ல இருக்கேன் அப்படிங்கிற ஒரு எந்த ஒரு ரீசனை வச்சும் he should not boast. He should not do any self-aggrandizement or marketing. Solicitation is totally banned. இதெல்லாம் நம்ம சொல்லி என்னோட ஹாஸ்பிட்டலுக்கு ஒரு பேஷண்ட் வரதுக்கு வந்து நம்ம வந்து எந்த வகையிலும் ஒரு தூண்டுதலா இருக்கக்கூடாது. So this is what the NMC says. There should be no solicitation. And we should not claim to be a specialist if you are not. நான் ஒரு pediatrician, நான் வந்து நியோனாட்டாலஜி ஸ்பெஷலிஸ்ட் அப்படின்னு சொல்லி நான் வந்து கிளைம் பண்ண முடியாது. என்னோட லெட்டர் பேட்லயோ என்னோட எந்த ஒரு இதுலயோ ஐ எம் ஸ்பெஷலைஸ்ட் இன் நியூ பார்ன் மெடிசன் அப்படின்னு சொல்ல முடியாது. சிமிலர்லி ஒரு ஜெனரல் மெடிசன் முடிச்ச ஒரு பிசிஷியன் வந்து he cannot claim he is a cardiologist. So never claim to be a specialist if you are not. And we are not supposed to associate with unqualified people. It can be a other Ayush staff or a non-medical person. We should not have any association. நம்ம வந்து டியூட்டி டாக்டர்ஸ்க்காகவோ இல்ல ஐசியூ மேன் பண்றதுக்காகவோ இந்த மாதிரி எந்த ஒரு பர்பஸ்க்காகவும் we should not be associated with unqualified people. And we should all display our consultation fees so that the patient is able to see that properly before they enter our consultation rooms. And informed consent க்கு வந்து ரொம்ப இம்பார்ட்டன்ஸ் கொடுக்குறாங்க. The NMC says that there should be no blanket consent. அப்படி ரெடி டு எல்லாத்துக்குமே ஒரே கன்சென்ட்டா வந்து we cannot have. So ஒவ்வொரு ப்ரொசீஜருக்கும் we need to have a separate consent. ஃபார் எக்ஸாம்பிள் இப்போ 2 சர்ஜரி இருக்கு, ஒரு பிரஸ்ட்ல இருக்க ஒரு லம்பை ரிமூவ் பண்றோம், ஒரு நோட் சாம்பிளிங் பண்றோம், 2 டிஃப்ரெண்ட் சர்ஜரிஸ்னா 2 செப்பரேட் கன்சென்ட் இருக்கணும். அண்ட் சர்ஜரி கன்சென்ட் செப்பரேட்டா இருக்கணும், அனஸ்தட்டிஸ்டோட கன்சென்ட் வந்து செப்பரேட்டா இருக்கணும். அண்ட் ஃபார் ஸ்டெரிலைசேஷன் எடுத்துக்கிட்டோம்னா போத் த கப்பல் we should have their consent. And IVF patient na the patient, spouse and donor, all three we should have a consent. And if you do any procedure without consent, that is considered a gross misconduct by the NMC. So நம்ம நெவர் வந்து நம்மளோட கிளைம்ஸ் வந்து எக்ஸாகரேட் பண்ணக்கூடாது. நம்ம ஒரு ப்ரொசீஜர் பண்ணிட்டு உனக்கு 100% கியூர் ஆயிடும் அப்படின்னு சொல்லிட்டு we should not exaggerate. Neither should be minimize. Patient சிக்கா இருக்கிற டைம்ல வந்து we should not say that nothing is a problem, you'll be completely cured. இந்த மாதிரி வந்து மினிமைஸ் பண்ணியும் நம்ம சொல்லக்கூடாது. And a doctor is free to choose his or her own patient. So if we do not want to see a patient except in an emergency, we can always refuse to see a patient. But once we have decided that this patient will be seen by me, we should never abandon that patient. So what is the question that occurs to many of us is, what do we do with a violent patient? So many times we have seen that doctors are being attacked, and then we can't expect the patient to be seen by the same doctor. So in these cases also the NMC has come up with norms saying that if there is a violent patient, you can refuse to treat the patient and you have to refer the patient to any other institution. It is no compulsion to see a violent patient, or the attender, if they misbehave with you, there is no reason for us to see that patient. So again, pharmacy norms வந்து NMC வந்து it is very strict. All of the hospitals should only give medicines to their own patients. They should not run a open house. நம்ம just like that வந்து என்டர் ஆகி ஒரு பேஷண்ட் வந்து they cannot come and get medicines from our pharmacy. So it can only be dispensed to our own patients. And the NMC also says that we should write legibly in capital letters using the generic name. The NMC has become very strict about this. So never use the brand name is what they suggest. Always use generics, and there should be no fixed dose combination. The doctor can give in bracket the suggested brand name, but always the generic should be given a preference. This is what the new NMC guidelines say. And pharma கிட்ட இருந்து gift வாங்கலாமா அப்படிங்கிறது வந்து we all get it in some way or other. We all know எப்படி டோலோ 650 வந்து 1000 crores வந்து டாக்டர்ஸ்க்கு வந்து allegedly வந்து கொடுத்து வந்து it has come into trouble. We all seen the news. According to the NMC, no commission, no gift, no hotel travel, no travel accommodation, anything can be claimed from the pharma. And the NMC also says if a doctor is getting a gift up to 5,000 rupees, he is okay, he'll be censured, he'll be warned. அதுக்கு மேல அப்படின்னா 3 monthsக்கோ 6 monthsக்கோ 1 yearக்கோ அவங்க பிராக்டிஸை சஸ்பெண்ட் பண்ற அளவுக்கு the medical council has rights. And medical records again வந்து for 3 years everybody has to compulsively save all the IP patient records. And in 5 days if somebody is requesting those records, we have to give it. So 3 years வந்து for all IP patients we have to save these records. And what about the professional relationship between doctors? Doctors should never do professional jousting. ஒரு டாக்டர் வந்து இன்னொருத்தரை பத்தி வந்து எந்த ஒரு வகையிலையும் வந்து தரக்குறைவா பேசக்கூடாது. And if the patient is even not properly seen by the first physician, the second physician வந்து ஒரு derogatoryயான ஒரு ஸ்டேட்மெண்ட் அந்த பேஷண்ட் முன்னாடி வந்து பண்ணக்கூடாது. தனியா இருக்கும் போது they can call up and tell that there is something wrong with that, but in front of the patient no doctor should do a bad remark about another doctor who has referred a patient or seeing another patient from another doctor. And for certificates also the NMC has issued guidelines. So fake certificates, the NMC has seen that lot of people are being given fake certificates. either the doctor themselves or people associated with the doctor, the staff, they manipulate the doctor seal, fake certificates நிறைய தராங்க. So the NMC, the Medical Council of Tamil Nadu has come up with this app, Doctor Certificate app. Anybody can download this and use this. நம்ம அந்த டீடைல்ஸ் நம்ம fill பண்ண உடனே வந்து அது ஒரு certificate generate பண்றது, and it is easy to take a print. And there is a list of all the certificates that we have issued. So everybody can download this app from the Google Play Store. இது வந்து தமிழ்நாடு மெடிக்கல் கவுன்சில் has certified this app. அவங்களே வந்து கிரியேட் பண்ண ஒரு app. It is called the Doctor Certificate app. So இதுல it is very easy to just go, you fill your details, நம்மளோட registration number போட்டுட்டோம்னா it is very easy to generate the new certificates.
Anata pachaye apateke na apatia apateke.
So we are all seeing like reels made by doctors. We have a doubt, is this allowed? The NMC is clearly saying that lot of activities that doctors do increasingly on social media, it is not totally allowed. So for example, a person who is boosting his reels on Instagram, he is making reels are allowed. You can make and create your own videos. நம்ம வந்து நமக்கு மெடிக்கல் எஜுகேஷனுக்காக நம்ம கிரியேட் பண்ணலாம். பட் அந்த வீடியோஸை வந்து நம்ம பூஸ்ட் பண்றது, மணி பே பண்ணி பூஸ்ட் பண்றது, அண்ட் மணி பே பண்ணி லைக்ஸ் வாங்குறது, ஃபாலோஸ் வாங்குறது, இது எல்லாமே the NMC has given clear guidelines about the social media usage. The NMC is saying that you should not pay money to buy any likes, follows and boosting. Again வந்து இது வந்து NMC is not approving this. And what about aggregators like Practo? Again the NMC says that it has clearly said இந்த மாதிரி ஒரு மெடிக்கல் அக்ரிகேட்டர்ஸ் நம்மளோட ரிவ்யூஸை வந்து பே பண்ணி ஒருத்தங்க டிஸ்பிளே பண்ற மாதிரி லைக் Practo வந்து they are not allowed அப்படின்னு சொல்லி இருக்கு. பட் again the medical council so far has not taken any action. Practo யூஸ் பண்றவங்க நிறைய பேர் இருக்காங்க. It has come out with an alternative and that is the search for doctor app அப்படின்னு சொல்றாங்க. இதுவுமே வந்து தமிழ்நாடு மெடிக்கல் கவுன்சில் தான் ரிலீஸ் பண்ணிருக்கு. இந்த ஆப்ல வந்து நம்மளோட டீடைல்ஸ் வந்து என்டர் பண்ணிட்டோம்னா the patient can go and search as per pin code. அவங்க சர்ச் பண்ணும்போது ஆல்பபெட் வைஸா வந்து அந்த டாக்டர்ஸோட நேம்ஸ் இருக்கு. So this app right now it is not functioning. There is some sort of a bug in that, but it was earlier it was doing a good job. So இது வந்து இந்த மாதிரி இது வந்து யூஸ் பண்ணலாம். பட் Practo வந்து not you allowed அப்படின்னு சொல்லி தான் மெடிக்கல் கவுன்சில் has told. So what about journal publications? Again இதுலயுமே வந்து the NMC has told that ஒரு பேஷண்டோட ஐடென்டிஃபிகேஷன் தெரியற மாதிரி இருக்கிற எந்த ஒரு இன்ஃபர்மேஷனுமே வந்து it should not be given. So you can mask the patient and then you can give. But ஒரு clear photo அந்த பேஷண்ட்டை வந்து அதுல கிளியரா அடையாளம் பண்றது முடியற மாதிரியான எதையுமே வந்து நம்ம ஜேர்னல்ஸ்லயோ ஆன்லைன் மீடியாலயோ ஷேர் பண்ணக்கூடாது. ஈவன் ஒரு டெஸ்ட் ரிப்போர்ட் நம்ம ஷேர் பண்ணணும்னா கூட பேஷண்ட் நேம் எல்லாம் பிளர் பண்ணி தான் வந்து நம்ம ஷேர் பண்ணணும். So anything that can lead to the identification of patient வந்து it is strictly not allowed. Public education of course வந்து it is allowed. Any doctor can talk about public health, hygienic living, ரேடியோல பேசலாம், டிவில பேசலாம், இன்டர்நெட்லயும் பேசலாம். அண்ட் இது வந்து ஆக்டிவாவே வந்து மெடிக்கல் கவுன்சில் வந்து என்கரேஜ் பண்ணுது. எனிதிங் டு எஜுகேட் த பப்ளிக் இஸ் அலோட். ஃபார் எக்ஸாம்பிள் வந்து நம்ம எல்லாருக்குமே வந்து அருண் சார் தெரியும். ஹி வாஸ் த லாஸ்ட் இயர் வந்து IMA ஓட லைஃப் ஸ்கில் கமிட்டியோட கன்வீனரா இருந்தாரு. He is giving lot of instructive information about lot of things useful to the public as well as doctors. All this is definitely allowed. இந்த மாதிரியான வீடியோஸ் வந்து நம்ம தாராளமா வந்து நம்ம போஸ்ட் பண்ணிக்கலாம். டெஸ்டிமோனியல்ஸ் வந்து நிறைய ஹாஸ்பிட்டல்ஸ்ல வாங்குறோம் நம்ம. ஸோ ஒரு பேஷண்ட் வந்து நம்ம கிட்ட பெனிஃபிட் ஆனதுக்கு அப்புறம் அவங்களோட ஒரு வீடியோ டெஸ்டிமோனியல் நம்ம எடுக்கிறோம். திஸ் இஸ் நாட் அலோட் ஆஸ் பர் த நியூ NMC ரூல்ஸ். எந்த டெஸ்டிமோனியல்ஸுமே வந்து நம்ம வந்து பேஷண்டோட இது ஐடி ரிவீல் ஆகுற மாதிரி நம்ம வந்து போடவே முடியாது. அண்ட் வி ஷுட் ஆல்சோ ரிஃப்ரெயின் ஃப்ரம் பிஃபோர் அண்ட் ஆஃப்டர் வீடியோஸ். ஒரு சர்ஜரி முடிஞ்சு பேஷண்ட் வந்து என்ன டிஃபரன்ஸ் இருக்கு அப்படின்னு சொல்லி நம்ம வந்து போடக்கூடாது. த பர்பஸ் இஸ் ஒன்னு பேஷண்ட் ஐடென்டிஃபிகேஷன், இன்னொன்னு போஸ்டிங். இந்த என்கிட்ட வந்தா இந்த மாதிரி ஒரு கியூர் ஆயிடும் அப்படின்னு சொல்ற மாதிரியான ஒரு சென்ஸ்ல வந்து we are not supposed to post. So before and after videos, even for skin procedures, even for minor procedures, it is not allowed as per the new rules. What about surgical videos? அது வந்து அவேர்னஸ் தானே, அது வந்து எஜுகேஷன் தானே அப்படின்னு நினைக்கலாம். அகெயின் சர்ஜிக்கல் ப்ரொசீஜர்ஸுமே வந்து NMC is totally not allowed this time. We are posting all of it online now. That should be without any identification of the patient, and their rules strictly say that surgical procedures are not to be put online.
Best skincare routine under ₹1,000. Here's what I use.
So we have seen lot of doctors doing influencer marketing or endorsement. ஒரு ப்ராடக்ட்டை காட்டி இந்த ப்ராடக்ட் வந்து வாங்குங்க அப்படின்னு சொல்றாங்க. Any kind of endorsement anywhere, whether it's a pharma product, a medical device, whatever, The NMC says that we are not supposed to do that. We cannot do any endorsement of any product online or media or anywhere. So that again is not allowed by the NMC. What about AI? எல்லாருமே ChatGPT யூஸ் பண்றோம். ChatGPT யூஸ் பண்றதவங்களே இல்ல. AI in healthcare is not allowed at present. ஒரு ChatGPT யூஸ் பண்ணி அனலைஸ் பண்ணி ஒரு கவுன்சிலிங்கோ ஒரு பிரிஸ்கிரிப்ஷனோ வந்து நம்ம கொடுக்க முடியாது. So right now AI is not allowed as per Indian Medical Council norms. In patient care, telemedicine is allowed. Telemedicine அப்படின்னா நம்ம ஒரு இடத்துல இருக்கோம், பேஷண்ட் இன்னொரு இடத்துல இருக்காங்க. NMC வந்து இதை ஆக்டிவாவே என்கரேஜ் பண்ணுது. த்ரூ வாட்ஸ்அப், through Facebook Messenger, we can use this devices to do telemedicine. We can get money from them also. For the consultation, we can get payment also. Any kind of video, audio, text messages, it is allowed to do telemedicine. So any patient can file a complaint within 2 years and the NMC will have a hearing. அது வந்து dismiss பண்ணலாம். It can warn the doctor or it can recommend counseling or ஒரு பெனால்ட்டியோ ஒரு சஸ்பென்ஷனோ கூட கொடுக்கலாம். அண்ட் ரொம்பவே கிராஸ் மிஸ்கான்டக்ட்ல வந்து there can be even permanent removal. And the Tamilnadu Medical Council has partnered with OmniCuris. So they are giving, we all know that the Medical Council is saying that 30 credit hours is needed for every 5 years. So this platform has lot of videos that we can see at our own நம்மளோட டைம்ல பாத்துக்கலாம். ஸோ இட் கேன் பி அ பீடியாட்ரிக், இட் கேன் பி அ ஃபிசிஷியன் டாபிக், என்ன டாபிக் நமக்கு இன்ட்ரெஸ்டடா இருக்கோ அந்த டாபிக் we can just log in and watch that video, and there is a certificate which you can download and upload it in the medical council also. So for ongoing education, the medical council is recommending this, that we have 30 credit hours for every 5 years, and even நம்மளோட AMS இன்னைக்கு நடக்கிற டாபிக்கு கூட we have credit hours for the same purpose. So with this, I'm just finishing the session. I am thanking the President, Dr. Senkatavan sir, the Secretary, the Finance Secretary, Chairman of AMS, and also the Honorary Secretary of the AMS for giving me this opportunity. And I am conducting the digital marketing strategy workshop for this year. So it is going to be for all doctors and any staff employed in any hospital in Tamilnadu. If you are having any negative reviews, fake reviews for your hospital, if you are doing Instagram videos and seeing that they are not going viral, and if you are depending on some other agency for your marketing purpose, I will teach you how to do it yourself. இது வந்து நியூ டாக்டர்ஸும் ஜாயின் பண்ணிக்கலாம், எக்ஸ்பீரியன்ஸ் டாக்டர்ஸுமே ஜாயின் பண்ணிக்கலாம். For other people, there will be a certificate. All these topics will be covered in the workshop. Thank you, and you can note down my number if there is any, if you want to communicate with me regarding this or any other doubts, you can note my number. Thank you, sir.
Thank you very much, Pradeep, for the wonderful talk on do's and don'ts of as per the NMC. I have one queries regarding the organizing the conference, whether regional, national.
Sir, we will have discussion at the end, sir.
Thank you very much. Thank you, sir. Thank you.
Aadhar Sendil.
Sendil, sir. Yeah.
Shall we go to the next session, sir? Now
Yes.
we invite the next speaker, Dr. V. Rajesh Babu, sir. He is senior neurosurgeon consultant at the Kanga Hospital. The topic is the anaphylactic shock and cardiac loading dose kit. We welcome Dr. Rajesh Babu, sir. Please, sir.
Good afternoon, everyone. Am I audible, sir?
Yes, sir. Yes, sir. Okay.
Today, I am going to give a talk about IMA AMS TNSB anaphylaxis and cardiac emergency kit. This kit actually we have released during the month of June in the state council meeting. I don't know how many of you know about it. I don't know, but this is an essential kit. This IMA AMS TNSB anaphylaxis and cardiac emergency kit. You must be wondering that I was wearing a small belt-like thing, and this is that bag, which is having IMA AMS anaphylactic shock kit. This is one paper ad which came, and one of our senior doctors from our Coimbatore area asked me, இதுல பார்த்துட்டு he has asked me, என்னப்பா இது என்னமோ கிராஸ் பெல்ட் மாதிரி போட்டிருக்காது என்ன அப்படின்னு சொல்லி கேட்டாரு. நான் அப்புறம் I told him, சார் இது வந்து அனஃபைலாக்டிக் ஷாக் கிட் சார், along with that the life saving cardiac loading dose is there. I told him like that. So once I have started this, I am regularly carrying this bag wherever I go to to any place, whether I am going for a hotel or whether going for a temple or wherever I am going, I am using this. Because this kit is one thing which everyone should have it. This kit is prepared all because of the fact that our IMA TNSB present honorary secretary Dr. Karthik Prabhu had an anaphylactic shock and recovered from that dire situation during November 2024 at his home. That only made me to think about this kit. I dedicate this kit to Dr. Karthik Prabhu sir. So this is the kit what I am talking about it. This is a small bag, it is there. In that there is a box. In that box the 3 covers are there. This is the vial cutter which we are having it. And on the box it is written as what are all the contents. It is showing that emergency medicine injection, the emergency tablets, and then emergency cardiac medicine, life-saving loading dose drugs. That's what given, and the cost of the drug, the kit is 400 rupees. And this kit is a very, very essential kit. The only thing which I have not requested our state office at the beginning of the talk was, I request the state office bearers to make it as a state IMA project, so that let it be available in all the IMA branches. So what is available in that kit is emergency medicine injection. That is injection dexamethasone 1, injection avil chlorpheniramine 1, injection adrenaline 2, and injection hydrocortisone 1, and disposable syringe and insulin syringe 1. That is for the subcutaneous injection. And the emergency tablets, 1 tablet prednisolone 20 milligram 4 tablets, the pantoprazole 4 tablets, the hydroxyzine 25 milligram 4 tablets, and vial cutter and cotton. See, why this kit was started was the history, the story I have to tell. Dr. Karthik Prabhu had a meeting at Chennai during November 2024, and then he was coming here to the airport, and he was taking the car from the airport on his own, and he was driving, and he went for a hotel to take burrata, and then he was going home. On the way to home, he had a sweating, and at the same time, he had itching. And the hospital, his house is nearby to that place, just hardly 3 kilometers. And he reached the home by the time, within 5-10 minutes, he reached. And while he was, his house is in the first floor and his hospital is in the ground floor. While he was crossing the hospital wards, he was telling to the sisters that, sister, you please bring injection avil and decadron. And then he was going to the top of the floor. And then he was sitting in the bed. And immediately, his wife is a cardiologist and his mother is a gynecologist. They are both sleeping. It is 11 o'clock. And only daughter was awake. And then suddenly what happened was, the sisters gave, and suddenly he was having breathing difficulty. And at that time he told, adrenaline kondu vaga. Abdin sollite, he became unconscious. And immediately the injection adrenaline was given, 1 dose was given, and then he woke up. That's what happened. Like that, he was telling what has happened on the day. So immediately from that next day onwards, he is carrying the same type of a kit along with him. Always he is carrying. And immediately I thought, why it should not be with everyone? So we will create a kit on our own, and we will create and we will send messages throughout the Tamilnadu and also throughout the country also, so that it reaches nook and corner, because it is an essential kit with the medical and paramedical people. That's what. And at the same time, I thought, why anaphylaxis only? We will add the cardiac emergency drugs also. The life-saving loading doses, the ecosprin, acetyl salicylic acid 325 milligram 1 tablet, the clopidogrel clopidogrel 75 milligram 4 tablets, and atorvastatin 40 milligram 2 tablets, and the pantoprazole 40 milligram 1 tablet. See, the anaphylaxis is the acute life-threatening systemic hypertensive reaction, can happen to any person. Mostly IgE-mediated reaction to food, drug, insect stings caused by sudden release of a mast cell mediators. Prevalence is 0.05 to 2%. Acute systemic reactions involving IgG-dependent mechanisms. Acute systemic reactions that can occur due to direct release of the histamine and other mediators from the mast cells and basophils anaphylactic reaction. Sometimes idiopathic anaphylaxis, no obvious cause. And once I went to a marriage and I was attending the marriage. At that time, one of my relative was telling, I am having allergy to chapati, wheat. I am having allergy. And then immediately I asked her, what you are doing? I am always carrying an adrenaline. That much is the awareness nowadays with the people. So she was carrying with an adrenaline actually. And since he is a non-medical person, she has stored she has filled the syringe and then kept in an ice cubes around it. And she was carrying with her wherever she goes. And so, in case of an acute crisis, we need a medical fraternity. IMA members should be having the first kit of emergency drugs always, so that we may be of use in dire emergency. See, when I was preparing and I was keeping for selling at the state council meeting, our IMA members were, some of the people were telling, sir, எங்கிட்ட அவில் இருக்கு சார், டெக்கட்ரான் இருக்கு சார், எல்லாம் கிளினிக்ல இருக்கு, இங்க வச்சிருக்கீங்களா, இங்க யாருக்காவது வந்தா என்ன பண்ணுவீங்க அப்படின்னு சொல்லி I asked them. Like that, at the same time, the adrenaline is not available always because it is a rare drug to be seen, and it is not, it's a short expiry. That's why everywhere it is not at all available, only in few centers, few places. If you go and inquire in 10 medical shops, in only one or medical shop or no medical shop will be having the adrenaline. So this carrying this emergency kit is an essentiality, compulsory for the IMA members. And the clinical diagnosis, this is a sudden onset of urticaria, itching, swelling, flushing red color, pruritus, itching of the skin, danger sign, respiratory distress rider, abnormal high-pitched musical breathing, wheezing, high-pitched fizzling sound made while breathing, dyspnea, shortness of breath, persistent cough, cyanosis, bluish or grayish discoloration of the skin, and mucous membrane, most commonly due to lack of oxygen. And on examination, the way we hypotension, chest pain, and collapse. First we watch for airway breathing circulation and then go for the IM adrenaline or subcutaneous adrenaline can be given. That's why we have kept a subcutaneous syringe, the insulin syringe, 0.3 to 0.5 milligram IM or subcutaneous in the outer thigh. 1 milligram per ml can be repeated every 5 to 10 minutes. Oxygen supplementation monitors SpO2. Normal saline fluid bolus 500 to 100 ml if available. Watch for urine output. Adjunctive therapies are H1 antihistamine injection. I will 45 milligram IM to be given, and IV corticosteroid methylprednisolone 125 milligram IV can be given. And refractory symptoms, if it continues, adrenaline infusion 3 milligram plus 47 ml of normal saline 50 ml syringe pump to run over 10 ml per hour. Injectable drugs are to be given to recover the illness, and oral tablets, the tablet omnacortial prednisolone 20 milligram and Panbric pantoprazole 40 milligram and hydroxyzine 25 milligram, one each can be swallowed immediately if the patient is conscious. This is about the acute coronary emergency. At the same time, in case of a sudden acute coronary symptom, chest pain, severe sweating, chest pain with breathlessness, we should immediately ask the patient to swallow first line protective drugs immediately. This is the first line protective drug, the Ecosprin 325 milligram 1, clopidogrel 75 milligram 4 tablets, and atorvastatin 40 milligram 2, and pantoprazole 40 milligram 1. So that there will be a temporary relief from chest pain and it covers the time of the transit. Immediately refer the patient to the cardiac center. It happened to me to go to Kadalur, and there also some people purchased the kit. And this is one, watch the talk of Dr. Mukundan, President of IMA. Like that, a good response has come from one of our IMA presidents. That's what happened. So, IMA TNSB anaphylactic cardiac emergency kit is available for sale. The cost of the kit is 400 rupees. For buying kits, you can contact me. I am preparing and keeping with me always. And those who want, they can buy. And this is the kit already I have shown you. This bag, the box, and then the cover, in each cover separately with injection separately, the tablets, emergency drugs, and then the cardiac drugs also are there. So the conclusion is that essential kit to be available at all times with the medical and paramedical personnel of our country. our IMA Tamilnadu State Office a request to take it as a state project and to make it available in all the IMA branches. Request all our IMA members to kindly spread the message about this kit to all the friends and relatives and also to Rotarians, Alliance members and voluntary organizations so that this kit can be a role model in the health sector contribution in our country. So when Dr. Jayalal came here to Coimbatore, at that time I told him, he told that this concept has to be sent to all the people. That's what he told. And the Joint Director of Health Services Coimbatore also attended the program. She told that you have to go and meet our minister and tell about this and then make it available everywhere. That's what the drugs are available, but like this kit is not available everywhere. That's what the Joint Director was telling. So I request our state office bearers to make it as a state project. Thank you one and all for the lecture, watching the lecture. Thank you.
Super, sir. Rajesh Babu, sir, this is an excellent idea. This is life-saving. And I purchased one kit from you in the last State Council meeting. I gave it to the South Rotary of Tirupur, sir. They were all very happy. They were all very happy. This is a novel idea. Definitely, I think all the small clinics and also the companies and so many firms should have these kits. We will definitely do the best to the society, sir. Thank you very much for your excellent talk. I think
I
we'll
need a
move on to
comment
next
from
question.
Dr. Karthik Prabhu, sir.
Rajesh Babu, sir, that's
Sir.
very nice that you've taken this far. And myself and Madam, my savior, is also there watching this. Because of adrenaline that day, I mean, the extreme risk was aborted. And from that time, I always carry. Rajesh Babu, sir, saw that I'm carrying this and he wanted this to be a project, which I really welcome, because at times of emergency, many people say they have this EpiPen and all this stuff. Very, very expensive, 5,000 to 7,000 rupees per pen. But the small adrenaline ampule hardly costs 15 to 20 rupees. It has an expiry at least 3 to 6 months. So I think we can preload it and keep it very comfortably. And inside a small box, that is good enough. And I know personally it works because it had worked for me. So from the time, even when people said we'll get something from abroad, I always think it is cheaper, easy to change. Just have one preloaded and the other one just for safety. And always in my hospital, because we also take care of cardiac patients, adrenaline will always be there. And I'm very happy and thankful that adrenaline was there that day. So that is going to be the most important thing. And I'm sure this has to be as an emergency kit in all the OPD centers too. Anyway, Rajesh Babu, sir, I really appreciate your interest and enthusiasm and the way you carry it, though you're not allergic to anything. For the benefit of others, you've been doing this very phenomenally. God bless and thank you. Thanks for the opportunity, sir. Thank you.
Thank you,
Thank you.
Dr. Karthik Prabhu and Dr. Rajesh Babu. It was wonderful. I am Dr. Prabhu, Dara Prabhu.
Hello,
Welcome,
Prabhu,
sir.
sir.
Beautiful, Tabu. Beautiful.
Thank you. Thank you. Thank you.
Sendil, sir, carry on.
Yes, sir. Yes, sir. Yes, sir. We'll go to the next topic. The next speaker, Dr. Mariano Anto Bruno. He's going to talk about the topic on how to deal with the first notice alleging negligence. Medical negligence notice, how to deal with. We welcome Dr. Anto Bruno. Anto, sir? Yes, sir.
Thank you, sir. Good evening, everyone. Good evening to the office bearers of IMA, and good evening, Rajesh Babu, sir. Good evening, everyone. Okay, now I'm just trying to tell you something very unconventional. You may not have heard a speech from this perspective so far. So whenever you get a notice alleging negligence, it may be a legal notice, or it may be a verbal complaint, or it may be a commotion, whatever be it. How should you react? To understand this, we need to know certain basics. We need to know something about law and something about psychology. Then we will see what to do after an allegation. And finally, if there is time, we will see how to prevent or reduce an allegation of negligence in your part. So to begin with, I'll tell you how the Indian jurisprudence and law has evolved over the past 3 or 4 decades, and what are the various levels of defense, and what are the various trials for medical negligence, whether it is a real negligence or whether it is just a fake allegation when you have done everything correctly. So the evolution of Indian law, this you should be very, very careful in understanding it. So essentially there are two philosophies in law. One is called a British philosophy and another is a Chinese philosophy. And Indian laws, the earlier Indian laws, that is the Indian Penal Code or the Indian Evidence Act or the Criminal Procedure Code, all these were based on the British philosophy where 100 criminals can escape but one innocent must not be punished. But what they found it in 1980s, they tried something different. They brought in new laws like the Narcotic Drugs and Psychotropic Drugs Act, that is called the NDP Act, the Terrorist and Disruptive Activities Prevention Act, the Prevention of Terrorism Act, Protection of Children from Sexual Offences Act. This came in 2012. And these all follow a Chinese philosophy in which 100 innocents can be punished, but one criminal cannot escape. So you may already know these terms, NDP, THOA, PODA, POCSO. So there is a huge difference between these two approaches. In Indian Penal Code or in Indian Evidence Act or in the crime CRPC, the full responsibility is on the prosecution to prove the crime. The accused is presumed innocent and any mismatch in evidence is enough to acquit, and independent witnesses are needed and benefit of doubt is always given to the accused. But in the latest acts, the full responsibility on the accused is to prove innocence. That is, suppose if you are charging someone under IPC 302 and told that he has killed a person, you have to prove that he has killed a person. But you are charging him under the latest acts, then he is automatically presumed to be guilty and he has to give evidence to show he is innocent. And the mismatch in evidence does not matter. They will take any single evidence which is in favor of the complainant and they will punish the accused persons. And the independent witness is also not needed in the sense the complaint enough is treated as an evidence. So now let us also see the various defenses which are there in the law. First is the lawyer saying that my client did the crime, sir, but under these circumstances. That is, for example, my client in self-defense. This is the least or the lowest level of defense. The little higher defense is saying that there is no evidence for my client doing the crime. That is, no one saw my client doing the crime. Show the evidence. And even higher level of evidence is that my client did not do the crime. That is, tell that my client was at a different place on that date. And you can go one further and said that there is no evidence for murder. Or you can say that the crime did not occur at all. The highest evidence is this, the crime did not occur at all. Now, understanding the difference between the older IPC, CRPC and IEC is that you can use any of this defense and you will be out. But in case of the latest act, only if you say the highest defense, you will be out. So what I want to tell all the doctors here is the case against doctors is approached like Narcotics Acts, THOA, PODA, POCSO by the consumer forums and court. That is, there is a full responsibility of the doctor to prove that there is no negligence. And the doctor is presumed to be negligent. And since the patient suffers, you punish the doctor. That seems to be the attitude. And then the consumer forum can give a judgment themselves without consulting an expert, or they can just disregard the expert's opinion and still say that there is a negligence. The next point is you have to understand that most of the lawyers you see, they were dealing with the old IPC cases, murder, theft, routine bail. They are not conversant with the new laws. And many lawyers have zero experience with medical negligence, and your case may be their first case. This is one of the reasons why there are so many cases where the hospitals did not do anything wrong, the doctors did not do anything wrong, but still they got penalized, they were awarded fine because the defense was not proper. It is because the defense was conducted in the old-fashioned way, whereas the bench, that is the consumer forum or the court, looks it at the newer way of looking at the things. So another point is till 12th May 19, so from 12th May 1914, if the doctor can be questioned by only 3 people, that is only Tamilnadu Medical Council or the government or the private hospital management you are working. But after 1994, what has happened is today you can be questioned by the medical council, government, private hospital management, consumer court can come and inquire you and award punishment for you. Police can file a case against you. Human Rights Commission, you will be called for Human Rights Commission or a local politician or Women's Commission, Minorities Commission, and there will be a media trial. There will be a social media trial. So this is something which each one of you should keep in mind. The times have changed. Today you have got a very, very less scope, and you should be knowing how to be very safe and how to avoid a negligence complaint. That is, avoiding a negligence is easy. Avoiding a negligence complaint is a different thing. There are many cases where even when you are done properly, some people will issue a fake complaint, and you should know how to break it up. And remember one thing, today healthcare is almost a teamwork. Unless you are sitting in a remote place practicing by yourself, in most of the places it is a teamwork. There is a primary doctors are involved, surgeons, physicians are involved, and their assistant doctors are involved, anesthesiologists are involved, both in theatre and in ICU. Nurses are involved in theatre and ICU. There is a big list of equipments. Hospital administration and other consultants are involved. Remember that all members of the team are tied with the same chain. Either you sing together or you get out together. Blaming one member of your team in your replied explanation will never help. In fact, it gives a solid evidence to the other party that there is a negligence. So whenever someone is alleging a negligence, please don't think that you can blame the other doctor or the nurse or someone else and then say that you are innocent. In the end, you also will be included in the same charge sheet and you also will be punished. Now let us see something about the psychology of the patient and family. For this, we will have to see about Kubler-Ross grief cycle. Essentially, there was a Swiss-American psychiatrist, Elizabeth Kubler-Ross, who enumerated various stages of human mind when dealing with the bad news. So whenever there is a bad news, the person gets is immobilized, that is shocked. Then there's a denial. Then there's an anger, comes a depression, testing and acceptance. For example, someone has failed in an exam. First, the patient will be stunned. Then they will say that, no, I have not failed. The website is wrong. Then there will be anger. Then there will be bargaining. It is not at all my fault. My teacher did not teach properly. The question paper was tough. The invigilator took my paper early. All these exceptions are called bargaining phase. Then there's a depression. Then they test themselves. Then they accept. Same way, suppose an industrialist is receiving a news that your factory is on fire. First he will say denial. No, it is not my factory. It is the next factory. Then he will be getting angry. Then he will say, okay, what can we do? Similarly, when a patient gets a complication or when a patient dies, when a patient gets a complication, he goes through all these stages. Or when a patient dies, the relatives go through all the stages. Now, what happens in this anger phase of the grief cycle is what is the stabbing the doctor, breaking the hospital, or going and shouting in the social media, or crying in front of the hospital with 20 cameras coming there, or then filing a case in court. So we have to understand that all the first allegation of a negligence happens in the anger phase, and as long as the patient is in the anger phase, you lose. The sooner you are bringing the patient or the relative to the acceptance phase, the case is over for you. So once someone is alleging you of a negligence or of doing something wrong, you have to convince the person that you are right and his allegation is wrong and he has to accept that. The sooner it happens, the better for you. So this I already explained. Now, this is the psychology of the patients. Now, there is something very unique about the medico-legal negligence cases is that in most cases, if you go to a lawyer and say you have to give the fees first. But in most medical negligence cases, the patient does not give the fees to the lawyer. Instead, the lawyer says that you have to give me 25% or 50% of the compensation ordered by the court. And now we have to use this point in our favor. Actually, whenever you get a lawyer notice, you have to give a very clear and detailed reply that the lawyer or someone trying to help the patient to get the money should get an impression that there is no money in this case. Actually, for this play, all these people who are helping the patient, they are doing it for sake of easy money. And if your reply is very good, then they will drop this case and move to some other work. So remember that you have to, whenever there's you are getting a allegation or a note, a lawyer notice or some complaint or CM cell petition, whatever be it, your first reply should deal with both the psychology of the patient and the psychology of the those who are helping the patient, and also the psychology of the authorities. So now we will see what to do after the allegation. As I have already told you, don't blame any team members. Don't accept any negligence. Don't offer to treat for free. And don't think that replying this will be the only work. If you are replying to this notice, you will get something from CM Cell, then you will get something from Tamilnadu Medical Council, then from Human Rights Commission, then maybe from police and so on. So the first reply you prepare should be very, very comprehensive and detailed, in the sense that if something comes next, you have to just send the same post again. That's all. You cannot, it is very tough to change your reply later, because the difference in your reply itself will be cited as that you have done something wrong and you have changed your records. So the first reply you give a very comprehensive, detailed reply, so that one, it prevents them from the proceeding further. That is the reply you should give them an impression that they have lost the case. The reply you should give them an impression that you have done everything correctly and the patient died due to the illness, and that the pursuing this is not at all effective. And so this is what I told you. The first reply you give should cover everything. You cannot draft one reply for a police complaint and another reply for a medical council complaint and another reply for a CM cell complaint and another reply for a human rights complaint, etc. Whatever reply you give, they should cover everything. The first reply itself should cover everything. Here is something I will want to tell you. So far, most of you have been taught not to tell anything extra, not to tell anything which is not asked. You should be very circumspect with your replies, or that they would have told you to be very polite in your reply and not to commit the reply. No. All those things were the approaches which used to be there in the earlier phase when the doctor was regarded highly. In today's era of media and social media, your first reply should be full and blasting. There is no point in hiding anything. For example, if you have not told something in your first reply, but you are telling it in the second reply, the court will immediately say that this is a newly created evidence. So this is I am telling this based on the me following this for the past 2 decades. I have drafted and given some 350 replies so far to various doctors who asked me personally, and I can tell that with my approach, none of the case has proceeded to the next stage. The lawyers and the patient have got an impression that this case is closed. So that the first reply itself should be full and ballistic. Okay, this I already told. So in short, you have to bring the patient to the acceptance phase, and you have to show the lawyers that this is not a case they can waste their time. And safeguard that the entire team and management, not just you. And convince the patient relatives that the death morbidity is due to the disease, and and give a message to the helpers that they cannot get money here. And another point is, it should be in the same language you got the notice. If you got the notice in Tamil, reply in Tamil. If you get the notice in English, reply in English. And it should answer each and every point in the notice. This is a mistake I have seen many times. The patient will be writing 9 points. One lawyer will draft 2 words that all these are fake. Unfortunately, there will be some true points in that 9 points. The 2 or 3 will be true, only 7 will be wrong. But when you say that this cannot be considered, the lawyer, consumer court or the regular court or someone who sees that, oh, so many truths that they are just dismissing and they will take the case. So you have to answer each and every point in the notice and quote each line para of the notice and say whether it is right or wrong. You copy that entire, you type that entire notice, then divide it into paras or lines or phrases and say that whether that particular phrase is right or wrong. And if it is wrong, you tell what is right, give evidence, and have all the documents in the annexure and appendices. Even if it is a 1-page complaint, you have to give a 40-page reply. That is the only way you will not get a further complaint. If you are replying by if you are giving a 1-page reply to a 1-page complaint, they will then move to the other Human Rights Commission. They will file to the government. They will complain to the JDHS. They will complain to the council, everything. So first reply itself, you give a very detailed explanation, the issue stops. And remember something, as far as a consumer court case or a court case, professional negligence case is concerned, irrespective of whether you win in the end or not, if there is a case going against you, you have lost for the time. It is going to give you a mental tension, it is going to give your family mental stress, and it is going to give the hospital atmosphere itself will be bad. So the winning is not, while winning at the Supreme Court is still important, the better win will be avoiding the case going to court at all. And how to do is to give a full ballistic reply to the first notice itself. And your reply should inform anyone that there is no negligence and this is a fake complaint. And you should show that your reply to each and every line, and you are not shied away from addressing any point. And you have accepted the true points and refuted only the wrong points. For example, this is a complaint. They say that mother was admitted to this general ward, then the care provided is not sufficient, then the condition worsened, then there was no treatment given, blah, 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 blah. So how to reply to this is, first and foremost, you mention the patient's mistake. So gone are their old days that you should not blame the patient, blah, blah, blah. Those are the old days, that is pre-90s. Today, you take the problem head on. You mention the patient's mistake. Boldly say that அறுவை சிகிச்சைக்கு பிறகு புற்றுநோய்க்கு தேவைப்படும் வேதி சிகிச்சை மற்றும் கதிரியக்க மருத்துவம் ஆகியவை செய்யப்படவில்லை. அதற்கு பதில் அவர்கள் மாற்று மருத்துவம் எடுத்துள்ளனர். அறுவை சிகிச்சைக்கு பின் கவனிப்பில்லை என்பதும் அவராலும் அவர் உறவினராலும் தெரிவிக்கப்பட்டது. That is, the patient had been operated elsewhere some 1 year ago, but they have not. After the surgery, they went away. They did not take a chemotherapy or radiotherapy. Your reply should stress this point. That is, today's complication is because of the failure of patient to take a chemotherapy and radiotherapy. The patient had a tumor, was operated, did not take chemotherapy and radiotherapy, and today the patient may die. And if the reason for dying is not the negligence of the hospital, but the fact that she did not take a chemotherapy and radiotherapy. If you are not telling this, those who are reading will never know. Then again stress. Second point is, you mention the patient's negligence clearly. And when there is any delay on the part of the patient, mention clearly. 9 மாத தாமதத்திற்கு பிறகு. Then give the full diagnosis. Don't shy at it. Give a very long diagnosis so that the lawyer understands that it is a very complicated disease. And tell that when someone says that hospital you give a reply. You told that the drugs have been given. You told that the tests have been done. And in this case, for example, patient had high urea, so contrast MRI was not done. And you blame that the MRI was not done because the patient had high urea. If you don't write it explicitly in your reply, the lawyer or judge will not understand. And for example, say, take this, they have told, the first para is told as unmai, but இது பணத்தின் பொருட்டு அடிக்கப்பட்ட விண்ணப்பம். This letter is for financial support. So just to tell that this letter is for financial support, and they are making a negligence to get money. Tell it in the first line itself. They have asked support. You can say this, and then the next line, and the care provided was not sufficient is the complaint. We say that we have given enough care and we list the care, and then they say that on 6/8/2025. Her condition was worsened. She became unconscious due to brain tumor, was moved to ICU. Yes, this is unmai. Whenever there is a true line, you accept the truth. If you are denying, if you are not doing like this, if you are not replying word by word or line by line, the judge or the another lawyer reading it will not understand what are the truths in your side. They will say that you have just totally dismissed that petition and you are hiding your problem. And say that despite the seriousness of her condition, there was no improvement. You say that it's a lie. She improved. And the processing for further treatment was slow. You refute, say that it's a lie. The scan was delayed because she had high urea. And the attending doctor informed that no actual treatment had been started and the patient was only on ventilator support. No, you tell it is false. Treatment was started. MRI was not done because patient had a problem. Now you may find it very boring, isn't it? That I am saying the same point again and again. But unfortunately, law doesn't work like that. You have to repeat as much as necessary. If they are writing a lie 7 times, you say 7 times that what they have written is a lie. If you are replying only once, what the other lawyer or the judge will or the consumer forum member will consider is that their 7 points are true. And give all the appendices. Take a xerox of the whatever documents you have, enclose it and send it. Again, I will tell you something. Your lawyer will say, no, we should not give you any details now. We should only give it during court. No. Those are the IPC, CEA, CRPC time methods. Today, in the case of latest law, whatever evidence you have, you give it at the first itself. This is another complaint. For example, so here, first is Tayar Anumadikapattar. Yes, that is true. The next point itself is, I'll show you here. Another Tayar Nalla Nilayil Anumadithirundom. Okay, that itself we have split it and said that இந்த வார்டுல சேர்த்தீங்கிறது உண்மை சார், ஆனா நல்ல நிலைமையில எல்லாம் நீங்க சேர்க்கல. நோயாளி நல்ல நிலையில் அனுமதிக்கப்படவில்லை. அவருக்கு மூளையில் புற்றுநோய் மிகவும் வளர்ந்த நிலையில், அதுவும் போஸ்டீரியர் cranial fossa, middle cranial fossa என்ற இரு பகுதியில் மூளை தண்டை அழுத்தி, that is brainstem compression, hydrocephalus and increased CSF pressure. And you mentioned the size of the tumor, 5.8 into 5.2, 4.9. So the first line itself you refuse it. A patient is having a 6 into 5 into 5 centimeter tumor inside the cranial cavity with brainstem compression, and they say நல்ல நிலைமையில் அனுமதித்திருந்தோம். Unless you refute this line, your lawyer or the opposite lawyer or the judge will not understand. They will say நடந்துதானே வந்தாங்க, நீங்க ஆபரேஷன் பண்ண பிறகுதான் உங்களுக்கு சரியாகல. First itself when they நல்ல, so you see this is the refuting this word is very much important. And you evidences the MRI report. And the next point he says is முதல் கட்ட அறுவை சிகிச்சைக்கு மட்டுமே மருத்துவரிடம் ஒப்புக்கொண்டோம். No, actually they got a consent, full consent. So we have copied and pasted the consent line. சமயம் செய்யப்படும் அறுவை சிகிச்சையானது நீர் செல்ல மாற்றுப்பாதை ஏற்படுத்தத்தான் என்பதையும், அடைப்பு ஏற்பட்ட காரணத்தை ஆற்ற இந்த அறுவை சிகிச்சை செய்யப்படவில்லை என்பதையும், this was in the consent. So we have copied and pasted it, and we have attached it in annexes 10 and 11. And then he says that முதல் கட்ட அறுவை சிகிச்சை செய்யப்பட்ட பிறகு ICU வார்டுக்கு மாற்றப்பட்டார். Yes, that is a true statement. Accept it. முதல் அறுவை சிகிச்சையில் குணமடையாத நிலையில், you refute that. Then whenever you get, if I get a complaint, whoever relatives who is signing on the daily register, you make a note of it and say that so many people have been informed. Then they say that அவரது இறப்பு குறித்து தெளிவாக விளக்கம் கொடுக்கப்படவில்லை. No, wrong. We have clearly explained to the following persons. And finally he comes. மருத்துவரின் அலட்சிய போக்கே காரணம். Now, if you have not replied to each and every point in the previous lines, anyone reading this will conclude that the patient died due to negligence. This is the importance that you have to refute each and every point. If you give it as a single paragraph, instead of quoting each and every point, if you are just giving 2 or 3 lines reply saying that this is the diagnosis, this is what we have taught, that will be taken as something called as an excuse. நீங்க முட்டு கொடுக்குறீங்க அப்படின்னு தான் சொல்லுவாங்க. அவன் சொன்ன பாயிண்ட் தப்புன்னு நீங்க சொன்னாதான் வாசிக்கிறவங்களுக்கு இது ஃபேக் கம்ப்ளைண்ட்னே தெரியும். And finally, நாங்கள் எங்கள் தாயாரே இறக்கும் நிலை ஏற்படுத்து. Yes, that was true. But why did she die? அவரது மூளையில் புற்றுநோய் இருந்ததால் தான் அவர் மரணம் அடைந்தாரை தவிர வேறு எந்த காரணமும் இல்லை. This you have to tell. She died. Oh yes, but unfortunately that is not because of negligence but because of the cancer. Next he has given a very beautiful statement in the complaint. எதிர்காலத்தில் இந்த நிலைமை வேறு யாருக்கும் ஏற்படக்கூடாது என்ற காரணத்திற்காக இந்த மனுவின் மீது விசாரணை நடத்தி எங்களுக்கான நியாயத்தை பெற்று தருமாறு கேட்டுக்கொள்கிறேன். We gave a brutal reply. மூளை புற்றுநோய் இருக்கும் அனைவரையும் காப்பாற்ற முடியாது. ஆரம்ப நிலையில் வைத்தியம் பார்த்தால் பிழைக்கும் சதவீதம் அதிகமாக இருக்கும். நோய் முற்றிய நிலையில் மரண விகிதம் அதிகமாக இருக்கும். எனவே பெரிய புற்றுநோய் மற்றும் முற்றிய நிலையில் இருக்கும் நோயாளிகளில் சிலர் மரணம் அடைவதை தவிர்க்க முடியாது. This will look like a common sense for you, but the lawyer or the consumer forum member or the court or the judges will not understand this. This statement is a very emotional statement, and unless you give this explanation, the other person will just think that you have done a mistake. So, தாயாரின் பென்ஷன் தொகையில் தான் என் குடும்பம் பிழைத்துக் கொண்டிருந்தது. Just make it a double bold and say that this complaint is for sake of money. And repeat it again. And then you give a list of appendices like this. And as I told you, no, don't worry about repetition. Remember this iconic scene in Tamil cinema. Sandhaikku pono aatha vaiyum kaasu kodu. Kamal used to say, repeat it again and again. Same way, whenever you got a complaint, you just refute it as many times as needed. Only those who are giving a fake complaint should be worrying about telling it again. You are telling the truth, so you have to tell it again and again. Taking home message is, medical negligence tried under Chinese way of jurisprudence. You are deemed until guilty till you prove yourselves. If your lawyer is not aware of this, you are going to suffer a lot. And expect attack from multiple angles. Prepare for the comprehensive reply at the first attack itself. A 2-page complaint requires a 60-page reply with adequate annexure and cross-in-text. And never accuse a team member. It is considered as an admission of negligence. And never waive charges or do another surgery for free. It is considered as admission of guilt. And if you have any doubts, you can mail me or you can WhatsApp me or you can call me.
You finished, sir?
Yes, sir. Yes, sir.
Oh, thank you very much, Bruno, sir. This is an excellent talk. You are covering all aspects while getting the notice. And the main take-home message of immediate and ballistic and brutal reply to the all questions is very validly taken by the members. I think we will have more questions at the end of the session, sir. Rajesh Babu, sir.
All for giving the opportunity. Today we had the regarding the organ donation day. Issues in the brain death and organ donation. Dr. Raghavendra was held up in secretariat, so he was not able to join. So I will cut short the lecture. Short. The Tamilnadu, the state organ donation day was celebrated for 23rd September 2023 onwards, and this has been practiced every year. This is because the 15-year-old AP Hidendran in 2008, his parents, Dr. Ashokan and Dr. Puspanjali, decided to donate these organs. This incident sparked a movement like a resurgence in organ donation across the state. To recognize and promote such donations, CM Karunanidhi declared the September 23 as the Organ Donation Day. This is my mother. Immediately after the death, we have donated the eye and also the skin. This I wanted to stress on that. Why it is so important? Which are the regular organ donations heard, known about it? Lord Ganesha, in the Mahabharata, and in the Kannapar, all these things are depicting about the organ donation. So, what is a brain death? Brain death is the brainstem dysfunction. That is the main thing. The brainstem, the midbrain, pons, and medulla oblongata, if they are not working, it is called the brain death. So, what are the functions of the brainstem? Are awakening, BP, the breathing, and eating, and deglutition, and pulse. All these things are the brainstem functions. Total and irreversible loss of function of the cerebral hemisphere and brainstem is called as the brain death. Is a condition where brainstem, midbrain, pons, and medulla oblongata are dysfunctions. So the common cause of the brain death is the tumor, trauma, intracerebral hemorrhage, or ischemia to the brain. So to protect our from the brain death, wear helmet while riding even a bicycle. The cause of the brain death is the normal brain will be like this, and cerebral anoxia is like this. And the normal brain is like this, and the cerebral hemorrhage is like this. And the normal brain is like this, and the subarachnoid hemorrhage is like this. And the normal brain is like this. This is because of the trauma and the hemorrhagic contusions and all those things. This is the normal brain, and this is because of the meningeal infections. So head injury, brain injury, spine injury, and the polytrauma produces the cause of the brain death. So once under treatment with the intensivist decide that it is a brain death stage, then we follow the instructions given by the Transplant Authority of Tamil Nadu, or ROTO, Regional Organ and Tissue Organ Transplantation Organization, or SOTO, State Organ Tissue Transplantation. How to find out the brain death? Coma, unresponsiveness to the deep painful stimuli. The following points are based on the Transplantation of the Human Organ Act, THOA Act 1994, which was dated 3/3/2008 was discussed, and the following recommendations were made by the Brain Death Committee 25/2023. Prerequisites to diagnose the brainstem death. Evidence of irreversible brain injury of unknown etiology, irreversible loss of consciousness, and cessation of the spontaneous breathing. We should exclude alcohol intoxication, depressant drugs, narcotics, muscle relaxants, primary hypothermia, hypovolemic shock, or metabolic or endocrine disorders. How to confirm brain death? This is an absence of the brainstem reflex, pupil fixed and dilated, corneal reflex, cough reflex, gag reflex absent, Dalsey movement absent, bilateral choleric testing negative, choleric test, and no spontaneous respiration, apnea test positive test, and flaccid extremities, deep tendon reflex are absent, pain response to pressure over the supraorbital ridge. How to confirm the brain death? Brain blood flow arteriogram we have to do. That is the confirmatory test. The CT cerebral angiogram, digital subtraction angiogram. The CT angiography is an ancillary investigation of choice and is recommended. The 4-point CT angiogram criteria has shown to have 100% specificity, 0% false positive rate, and 85% sensitivity, 15% false negative rate. The 4 vessels looked at are 4-point scoring system are: one is the right cortical branch of the middle cerebral artery M4 segment, left cortical branch of middle cerebral artery M4 segment, and right in ICV and left ICV for each vessel that shows a lack of contrast flow. 1 point is given. If all 4 vessels show no contrast, then it is a score of 4 by 4. That implies patient is brain dead. Score of 3 by 4 or less is negative for brain death. Sequence of clinical and ancillary test. Ancillary test is done minimum of 6 hours after the first set of performable components of the clinical brain death. To confirm the brain death, ancillary test. If ancillary test demonstrates angiographic findings supporting the diagnosis of brain death, second set of clinically probably performed tests are to be done immediately after a positive ancillary test. And if the clinical findings are concerned with the diagnosis of the brain death, the patient is declared dead. All the above findings are to be present on 2 occasions 6 hours apart, 12 hours in the cases of children. If ancillary test is negative, time period to repeat the test is repeat after 24 hours if strong clinical grounds for brainstem death persist. Patient should not have taken poison. How to finalize the brain death? Certifying doctors are team of 4 doctors must certify brain death. RMP in charge of the hospital. The head of the institution, RMO, ARMO, duty RMO. Second is the neurologist or neurosurgeon. If not available, surgeon or physician and anesthetist or intensivist who are empaneled by the appropriate authority transstand in Tamilnadu. The RMP nominated from the panel of names sent by the hospital and approved by the appropriate authority, physician, surgeon or intensivist. And fourth person is RMP treating of the deceased person. No clearance required from the appropriate authority. These are all the only 4 people only need to be certified brain death. And that has to be done apart 6 hours. The specialists that need to be empaneled with appropriate authority for brain death certification, the following specialties must be neurophysician, neurosurgeon, anesthesiologist, intensivist, general physician, general surgeon, pediatrician, respiratory physician, and cardiologist. So this is the importance of the organs is the more than 5 lakh Indians are dying every year just because of the failure of the major functioning organs at any time. So the 4 persons are required for certification of the brain death, and then the criteria, the ancillary tests, and also the CT angiogram or the confirmatory test to certify the brain death. And once the patient is brain death certification is done, the subsequently the procedures has to be carried on. That is the main thing. And we will stop at this juncture because this is enough regarding the brain death certification. And usually the National Organ Donation Day is celebrated on 13th of August. I request all the IMA branches to conduct at least 1 program about the organ donation throughout their area and then inform it to the state office. That is very important thing. And this year, actually, 4 days back, Tamilnadu is once again awarded the best state to get the organ donation. That is number 1 state. And out of which the Tirunelveli Medical College has been awarded the center for the more number of the brain death certifications. That's what happened of the recent times. So thank you one and all.
Thank you, Dr. Rajiv, sir. Excellent speech.
We can display. But a lot of things we have learned today. Every day we are learning. I thank all the IMA leaders for the wonderful opportunity in the IMA AMS platform to disseminate knowledge across the nation. I thank our chairman Rajesh Babu sir, other Sindhu Kumar Joint Secretary, and all the speakers. So Dr. Bruno and Dr. Pradeep Kumar. So Dr. Rakhavendra is not able to take part. He's emergency meeting in the government setup. He is one of the transport authority in that council thing and all, not able to participate. So we'll utilize next time. So we had a wonderful talk by Rajesh Babu sir, 2 talks. So today we have a lot of take-home messages. I thank you all the delegates. So without you, we can't have this kind of program. I request everyone kindly join AMS as a live member. Just 1,180 only. So we have a conference, AMSCon, that is National AMS Conference at Chandigarh. Welcome everyone to take part. And there are a lot of things. Every month, the first Thursday, we have IMA AMS webinar 3 to 5 with the CMA credit points. And please apply the CMA credit points and update yourself and keep updating. Long live IMA, long live AMS. With that, I conclude my talk. Thank you very much. Thank you, technical team, Santosh, for all the good support from our IMA side. Thank you, leaders. Thank you, delegates. Welcome. God bless you.